Okay, hello to everyone. Dear students, in today's session, I have brought some OBG questions, with the questions which has been asked and answered repeatedly. So I have taken those questions and all. So let's start the discussion. Number one, the first question: at what time during prenatal development should the nurse expect the greatest weight gain? The fetal weight gain will be there. So कौन से वीक में सबसे ज्यादा weight gain होता है? तो you should now let's have a discussion regarding to some theory also. A total weight gain, okay, a total weight gain during pregnancy is 11 kg. That has been distributed in first trimester, second trimester, and the third trimester, dear. So सबसे ज्यादा जो weight gain होता है एक pregnant lady का, the answer for what you think is the third trimester. The answer will be your third trimester, dear. क्योंकि first trimester में it is all about 1 kg, and then 5 kg second, and the third trimester 5 kg, but the maximum is the third trimester. The answer is the third trimester. Good. Okay, let's see the second question. A nurse is caring for a client during an ultrasound. Okay, ultrasonography के time वो assist कर रही है client nurse. What parameter does the nurse expect to do to be used when determining the pregnancy date? So in this question, what do you think? Number one option, occipital frontal diameter, crown rump length, biparietal diameter, or diagonal conjugate between 26 to 37 weeks. So what do you think in this? What will be the answer? Dear, the answer is nothing but is second, crown rump length. Okay, so whenever the ultrasound is being done during the first trimester, तो crown rump length of the baby, मतलब crown rump length मतलब क्या होता है? Okay, if this is the baby in the ultrasound, okay, so they will, as a whole, they will check the height. Okay, so that is known as a crown rump length. Crown means from the feet, from the this, okay, from head till that feet area of the baby, it will be checked, and that is known as a crown rump length. अब बात की जाए बाइपैराइटल डायमीटर कहाँ हम पढ़ते हैं एंड डायगोनल कॉन्जुगेट कहाँ पढ़ते हैं? बाइपैराइटल डायमीटर, whenever there is a mechanism of labor, in that usually we go check the biparietal diameter and all. If we talk about the diagonal conjugate, ये जो conjugates होते हैं हम क्यों चेक करते हैं किसी प्रेग्नेंट लेडी में? टू सी whether the pelvis is adequate or not. Pelvis adequate है या नहीं, तो हम diagonal conjugate everything we will, ठीक है, we will check so that we will rule out that there is any kind of cephalic disproportion is there or not. Okay, so the answer for this is crown rump length. So now you understood the two questions. Let's discuss the next question. What changes does the nurse expect in a client of hemoglobin system during the second trimester of the pregnancy? ऐसे क्या changes होते हैं blood में? ठीक है, जो changes pregnancy में देखते हैं, आपको क्या लगता है? See, प्रेगनेंसी में क्या होता है? हीमोडाइल्यूशन होता है, एवरीबडी नोस. ओके, सो अल्टीमेटली whenever there is a dilution is there, okay, hemodilution is there during pregnancy, dear. So क्या होता है अगर ये मदर का ब्लड है, तो you have seen there's a lot of this hemodilution word is known as a physiological changes which happens during the pregnancy, dear. Okay, so इसमें से आपको क्या लगता है? Ultimately, there will be an increase in blood volume. Okay, there will be number two. The option will be the increase in blood volume. Okay, hemodilution होता है pregnancy में, and all the levels changes accordingly. Okay. Now, next question. During a physical in the prenatal physical examination, prenatal clinics, the client's vaginal mucosa is observed to have a purplish discoloration. So color changes होते हैं pregnancy में, which is also a physiological change during pregnancy. So we are having so much of sign are there. ठीक है, तो okay, so what do you think could be the answer? Whether it will be Hagar sign, whether it will be Goodell sign, or Chadwick sign, or Braston His. The answer will be, what do you think? The answer for this question is the Chadwick sign. Okay, so during pregnancy, there is an increase in blood circulation to the organs. Okay, ज्यादा increase होता है vulval area में, तभी वो color changes होते हैं. That's why the color will look edematous. It will be edematous as well as purplish bluish color will be there. Okay, so the answer will be the Chadwick sign. ठीक है. Goodell sign की बात कीजिए, ये क्या है? That is a softening of cervix there. Okay. And then Braxton, his contraction, it is a kind of contraction which is felt by the mother. कि बोलते हैं कि बेबी का movement feel हो रहा है mother को, the first kind of contractions are there and all. So that is known as a Braxton Hicks contraction. The answer for this is Chadwick's sign. The next question: what does the nurse explain to a pregnant client about the cause of her physiological anemia? क्या एक नर्स एक्सप्लेन करेगी कि क्या कॉज हो सकता है, क्यों हुआ है आपको एनीमिया में, एनीमिया ड्यूरिंग प्रेगनेंसी डे? ओके, ultimately this is the repeated question which already I have discussed the second question, I think so. आपको क्या लगता है? The answer is the plasma volume increase. Okay, so always remember, if I will tell you to define what is anemia during pregnancy, the answer will, what you will be answer? The HB level less than how much? The HB level, if it is less than 11 gram per day during pregnancy, that is defined as a anemia in pregnancy. Okay, is that clear? So you cannot go to different ranges. The answer is 11 gram per day. Okay, you should not take other ranges. So एक physiological anemia होता है, क्यों होता है pregnancy में? Just because of the hemodilution there, hemodilution. Now, next question. A nurse revises the blood test and the results of the client who is at 24 weeks of gestation. What findings should be reported to the healthcare providers? ठीक है, इसमें से कौन सी फाइंडिंग्स हैं जिसे हमें इमरजेंसी रिपोर्ट करना है डॉक्टर्स को, कि अगर आपको लगता है नॉर्मल रेंज में नहीं है? ओके, the platelets is around this much, you know, the 1.5 लाख से 4.5 लाख platelets counts होते हैं, which is within the normal range. The HB is around 10. The fasting sugar is 90 and WBCS is this much. So you know, so what is the range of WBCS? Is around 5,000 to 11,000. So what do you think the answer will be? The answer for this is dear hemoglobin. Hemoglobin 10. I already told you an HB which is less than 11 gram per day is said to be like anemia during pregnancy. Okay. Okay, good. So next question. A nurse is assessing a pregnant client during the third trimester. Third trimester में एक nurse assess करिए client को. What clinical findings is an expected response to the pregnancy? आपको क्या लगता है कि इसमें से कौन सी चीजें हैं जो प्रेगनेंसी में होती हैं and which happens during pregnancy? So whether it is a tachycardia, whether it is a dyspnea at rest, progressive dependent edema is there, or shortness of breath on exertion. So shortness of breath on exertion is the answer for this is therefore. क्यों? क्योंकि प्रेगनेंसी में क्या होता है कि just because the uterus is enlarging and it becomes an abdominal organ, ultimately the diaphragm is also increasing. So ultimately this thing, this is the abdomen, okay, and this is the uterus, and this is your diaphragm. So जब uterus increase होता है, ultimately the mother will gonna say कि I'm having a shortness of breath is there. Okay, the answer for this is 4. Good. Next question. Let's see the next question. A pregnant woman reports nausea and vomiting during the first trimester of the pregnancy. An increase in which hormone should a nurse explain is the precipitating cause of the nausea vomiting? तो आपको क्या लगता है फर्स्ट ट्राइमेस्टर में क्या कॉज हो सकता है nausea vomiting during pregnancy? Whether it is an increase in estrogen, or whether it is an increase in the progesterone level, or whether it is a third option is luteinizing hormone or chorionic gonadotropin. See, estrogen and progesterone does not play a major role in like with nausea and vomiting there. The answer for this is therefore, because nausea vomiting क्यों होता है during pregnancy? Why there is a nausea vomiting? It's just because of the increasing level which is known as HCG level, जिसकी वजह से जिसे बोलते हैं hyperemesis gravidarum also. If a mother is having, so in which cases you will gonna see a high HCG level. If a mother is having a multiple pregnancy, there will be increase in HCG. Okay, there are other causes also. So ultimately, the mother will going to have a vomiting and all. Not so vomiting hoga first trimester, and then the HCG level decreases. Okay, till 11 or 10 weeks it increases, and then it goes on decreasing level. Okay, the answer for this is, see, progesterone का काम क्या है? प्रोजेस्टेरोन का काम है वो यूट्रस की जो लेयर्स है उसको रेडी करता है, तैयार करता है, द बेड. Okay, so that is the work of the progesterone and all. Okay, and what is the function of LH? LH has a function for the ovulation. When there's an increasing LH surge, there is ovulation. Is that clear? Okay, let's move towards the next question. So, during a client's first visit to the prenatal clinic, a nurse discussed the pregnancy diet. The client states that her mother told her that she should restrict her salt intake. तो एक प्रेग्नेंट वुमन को एक उनके फैमिली मेंबर ने बोला कि आपको नमक नहीं खाना है ड्यूरिंग प्रेगनेंसी. What is the nurse's best response? इसमें से क्या best response? What do you think? Your mother is correct. Whether the nurse should say कि हाँ आपकी मम्मी ने सही बोला, because second option, because you need salt to maintain your body balance level, it is not restricted. Okay. Third one, salt is an essential nutrition that is naturally reduced by the body's estrogen. There is no reason. Number 4, we no longer recommend that the salt intake be unrestricted as much as in the past. The answer for this is, what do you think? See, the answer for this is 2. See, mother should not be educated that you have to restrict the salt. It's a normal, ज़्यादा excess में नहीं लेना है, dear, but it should not be restricted, and it's play a major role in maintenance of the body fluid and all. So it should not be kind of restricted. Okay, next question. A pregnant woman tells the nurse in the prenatal clinic that she knows that the folic acid is very important during pregnancy, and she is taking a prescribed supplement. She asks the nurse what food contains the folic acid so she can add them to her diet in its natural form. Which food should the nurse recommend? Select all that apply. So what do you think? Among the option is rich in folic acid. क्या लगता है इसमें सबको किसमें folic acid होगा? What do you think? The answer for this black peons and beans and enriched breads and pasta and all. Okay, these are rich in folic acid. So let's have a small discussion, because you should know that folic acid is taken prior to the pregnancy also to prevent neural tube defect in the baby. So what are the foods which are rich in folic acid diet? So these are the, you can see spinach, okay, chicken, liver, legumes, okay, beetroot, omega, and all those things, liver, fortified cereals, जैसे बोलते हैं राजमा, उसमें भी folic acid होता है, black beans, ठीक है? Okay, is that clear? So all these things are rich in folic acid and has to be like educated. So let's go back to the question. Okay, so beans, all those beans whichever you see in your kitchen and all are rich source of your folic acid. Okay. Next. A nurse who is caring for a mother and her newborn infant reviews their record using the data below. Which nursing intervention is required? So what do you think in this report in which there's a we need some kind of intervention and all? So if you talk about the RH A not negative, so blood group A negative hai. Okay, if you talk about the rubella titer, it's 1:2 dear. VDRL is negative. So can you tell me where we are doing this VDRL test? कौन से इसमें करते हैं? इसमें करते हैं, जल्दी से बताइए. It's about, yes, syphilis. Okay, syphilis is the answer. Okay, मैं लिखनी भाई syphilis. Okay, syphilis is the correct answer. ठीक है. Next, HBS, AG, HIV, all things are negative. Then hematocrit, HB भी बताया है 11 and 33, and sickle cell is negative. Blood group, total bilirubin, O negative, and hematocrit. See, the answer for this is your rubella titer. Okay, so normal rubella titer should be around 1:8. If it is less than that, that means mother is having increased chance of having rubella and all, and she needs to get injection. Always remember, rubella injection is not given during pregnancy and all. Is that clear? So answer is this rubella, and the titer should be around 1:8. Okay, not less than that. Next. So यही ऑप्शन है, तो इसमें से कौन सा हमें बताना है? तो रुबेला जो है वो दैट इज द ऑप्शन, मैटरनल रुबेला वैक्सीनेशन है. ठीक है. नेक्स्ट क्वेश्चन, लेट्स सी. Okay, so during prenatal examination, a nurse draws a blood from an Rh negative client. The nurse explained that an indirect Coombs test will be performed to predict whether the fetus is at risk of developing. See, इसमें से क्या लगता है कि एक RH नेगेटिव मदर का ब्लड लेके Coombs टेस्ट हमने किया है. ठीक है. ओके, तो व्हाट वी आर गोना चेक. ठीक है, क्या बेबी में RDS है और एनी काइंड ऑफ प्रोटीन or physiological hyperbilirubinemia. The answer will be your acute hemolytic anemia, क्योंकि RBCs break down होंगी. If there is a RH incompatibility is there, तो वो mother and the baby's blood will continuously gonna break down there. So acute hemolytic anemia will be there. Hemolytic anemia will be there. So अगर हम RH negative pregnancy की भी बात की जाए थोड़ी सी, तो उसमें आपको you should have a knowledge. The baby, if the baby of a RH negative mother, usually हम बोलते हैं कि you can say कि they are having when ultrasound is done, okay, they occupy a Buddha position in that ultrasound, okay, and the mother should receive NTD during pregnancy if she's RH negative and on around 28 weeks of gestation. 28 weeks के gestation में she needs to receive NTD injection and within 72 hours of pregnancy. जब baby delivered हो गया, mother को मिलना है, baby को नहीं injection, mother को. Okay, if she is RH negative. So so that's all the question I have brought today. So we will discuss more question in the next session also, dear. And then thank you. Hope so if you like this video and all.